Singapore has done a lot for the migrant population, especially after COVID-19. We have a whole healthcare support system in place for them, but one of the main issues I found was that there was a gap between these services and the access to these services. Hi, I'm Matthias. I founded Project Migrant Health Matters. We run a program aimed at helping migrant workers overcome realistic barriers to healthcare access. Sometimes I'd have to come back just to pick up some of the expendable items that we use for our health screenings. These screenings always take place on a Sunday. Most of our funding comes from two organizations, Hope Initiative Alliance, HIA, as well as the Rotary Club of Singapore, or we will do active fundraising. Notably, this bag contains spectacles, glasses with degree that we would give out to the migrant workers after we've done a simple visual acuity check for them over there at the screening. All of our 50 to 60 volunteers have arrived. Usually when they arrive, it gets quite crowded. As you can see, all of them are busy moving the equipment around inside there. It gets a bit hectic. There are always a lot of questions that come up. But I'm glad that they're enthusiastic. They're here despite the scorching heat of this Sunday afternoon.
This project allows us to interact with them in a way that we haven't before, being able to really understand their needs, being able to understand their problems, being able to see exactly how we can help them. And I think personally for myself and all the volunteers, it is an extremely eye-opening and extremely interesting experience for us.
So for me personally, I'm actually Bangladeshi, so same background as the majority of migrant workers that are here with us today. And the reason why this is so important to me is because personally, I can connect with them to a certain level that I know a lot of my peers can't. I understand the troubles that they face in actually expressing the issues that they have. So it's not just that they sometimes can't access healthcare because of financial reasons. Sometimes they do get to access their healthcare, but because they can't accurately talk about their issues, they can't get the help that they need. So for me, I usually help to translate whatever conversations they have with migrant workers to the doctors so that they can get better help with the language support provided to them.
In general, when youths give back to the community, they engage with a lot of people on the ground, and this could include people from the low-income families or even vulnerable populations, in this case migrant workers. And through all of these interactions, develop better communication skills and empathy. And as a result, I would believe that all of this would help Singapore develop into a more cohesive society.
Being able to develop a sense of empathy towards this group, it will allow us to just build a more compassionate environment in a few decades to come. We will definitely still need migrant workers. We will still need them to continue growing our country, and they will always be here. But is there a way in which I can make our country a more livable place for them in the few decades to come? I think so, and the first step to that is youth volunteerism.